Hello, and welcome to Lupus, Sleep, Rest, and Counting Spoons. I'm Annika Hazlitt, a member of the Board of Directors of Kaleidoscope Fighting Lupus, and your host. Today, to talk about the importance of sleep, rest, and pacing yourself, is Dr. Dawn Thomas, a clinical rheumatologist, the author of the Lupus Encyclopedia, and a dear friend of KFL. Before we hear from Dr. Thomas, I would like to thank our program sponsor, GSK, for their generous support in making this educational presentation possible. I would also like to thank our community sponsors, 7 Minute Cinemas, Tin Rocket, Blue Eyed Crow Studio, and Due North Studios for their support. Now, let's hear from Dr. Thomas.
Well, thank you, Annika, for that very kind introduction. If you're watching this video, it's probably because you have trouble sleeping. Well, guess what? You're not alone. On a regular basis, I have patients with lupus tell me how they're having a lot of trouble sleeping, trouble falling asleep, staying asleep, or waking up in the mornings feeling unrefreshed, like they did not have a good night's sleep at all. And then they almost always have horrible fatigue or tiredness associated with it, and that can greatly affect the quality of life. So during this talk, we're going to talk about several things. Number one, can sleep affect lupus or vice versa? And also, and more importantly, at the end, I'm going to give you some great advice on how to help your sleep. I'm going to tell you the number one thing that the sleep experts recommend to help people with insomnia. So let's get started. So first, this is an article that just came out recently from MedPage Today. It was an article about low sleep tied to lupus risk. But then the big question is, which way does the causal arrow point? In other words, which came first? The problem sleeping or the lupus causing the sleeping problem? Well, there was a study done, a very interesting study done by the Oklahoma Medical Research Facility. They have a really good lupus department there doing some fantastic research with Dr. Monroe and her colleagues there. But they presented this article entitled "Less than 7 hours of sleep per night is associated with transforming to systemic lupus erythematosus." What they did is they have a very large group of lupus patients, but they're also following their family members. They looked at 436 relatives of their lupus patients and followed them over 6 years. And then they asked a whole bunch of questions on what could possibly increase the risk of these people developing lupus in the first place. Very interestingly, after 6 years, 56% of them developed lupus. So think of that. When you have family members and you have lupus, over 10% of them could possibly develop lupus at the 6-year mark. And that's not even including, what the possibility is after that. So there's always that increased risk because of your genetics. And then they compared these patients to the people who did not have lupus. And they asked a very interesting question. Who got less than 7 hours of sleep before they developed lupus? And the numbers came back that about a third of those who did not develop lupus were having problems sleeping throughout the entire time. But in the people who developed lupus, 55% of them were getting less than 7 hours of sleep before their diagnosis of lupus. And when you look at that slide, I put a circle around a number called P equals 0.005. That shows the statistically significant importance of this number difference. For those of you who are scientifically minded, you know that all you have to do is have this number to be 0.05 or lower. And this is 100 times lower. So this is an incredibly statistically significant result. But is it true? That's the question we want to try to answer. Then they asked another question. For those who are getting less than 7 hours of sleep, what was their risk of getting lupus in the first place? And the answer was that it was 3-fold increased risk of getting lupus. In other words, when they looked at the relatives of people who have lupus and those who are having insomnia or not getting enough sleep at night, they were 3 times more likely to develop lupus than those who are getting a good night's sleep every single night. Now there's another study that was very interesting, and this is a study that's actually been going on since 1986 called the Nurses' Health Study. This is a fantastic study where they've been following nurses in America for multiple decades, and these nurses, they regularly fill out questionnaires as far as what medical problems they're having. Do they smoke? Do they drink? Are they sleeping? Are they stressed? Are they depressed? To try to figure out what kind of things can potentially cause disease or decrease disease. And one of the questions that they asked is, how about those nurses who developed lupus? Could sleep have any influence on that at all? Now this study, they looked at over 186,000 nurses, and there was a total of over 4 million person years in this particular study. A way to think of that, by the way, is this is looking at over 4,000 people over the next year. They basically take each person, multiply the number of years they've been followed in the study, and add all of those up. So this is a lot of years of research that they've been studying it. And what was their results? Well, they came up with this study result just a couple of years ago. This is by Dr. Kostenbader and her colleagues at Harvard, and they published this study called Association of Sleep Deprivation and Risk of Developing Systemic Lupus Among Women. And they looked at those women or those nurses who were getting 5 hours of sleep or less compared to those who are getting more than 7 hours of sleep on an average basis over time. And they asked the question, do the people who have less sleep, do they develop lupus more often or not? And what they showed in their study is that those who were having insomnia or not getting enough sleep, maybe working too hard, for example, they had a 2.5-fold increased risk of developing lupus, pretty close to that 3-fold risk that we saw in the other study. But then you have to ask yourself, is it cause or effect? Did the lack of sleep actually cause lupus to occur in people who have the genetics that can cause lupus? Or what if lupus itself was causing depression and pain and causing the decreased sleep? So the doctors at Harvard, they answered this question in their study as well. So what they did is they removed the effects of depression and pain. They knew which people or which nurses were having depression and pain along with their lack of sleep. And then they looked at the statistics for that particular group. And what they showed is that the lack of sleep had a 2-fold increased risk of developing lupus. So even when you removed things that can cause decreased sleep, there was an increased risk of developing lupus. So it seems like it's a trigger for developing lupus in people who have a genetic predisposition. Another question you can ask is, does the lack of sleep cause lupus to flare up in the first place? There's only one study that I could find that can answer this question. It was a very interesting study. It came out of Australia, and they asked this particular question. They asked a large group of lupus patients, 80 of them, what kind of triggers in your life will cause lupus flares? In other words, you're doing fantastic, then all at once something happens, such as too much sun exposure or too much cigarette smoke exposure or not sleeping very well. Did you then have a flare of your lupus? And what they showed is that 14% of these women with lupus identified the lack of sleep or insomnia as an actual flare of causing their lupus to flare up. But we still have to ask ourselves, which came first, the chicken or the egg? Did the lack of sleep cause lupus flares, or did the lupus flares cause the insomnia because of things such as depression and so forth? So the women with insomnia also had other problems associated with their lack of sleep. 100% of them had significant fatigue and tiredness. Now, this is one reason, by the way, when I have a patient with lupus or any problem, by the way, tell me that they're horribly fatigued and tired, the first question I ask them is, how much sleep are you getting at night? The vast majority of the time, they'll tell me 5 hours or 6 hours, which is definitely not enough sleep. In fact, if you go out on the street and ask any American or any person in the world, are you tired or fatigued? A large percentage of them are going to say yes, and they're going to tell you that they just don't get enough sleep at night. So you always have to target sleep to help out with fatigue. Pain, 85% of them had pain. About half of them had headaches, and about 1 out of every 4 or 5 patients had brain fog or problems with memory. Just think of that. Many of you who are watching this have significant brain fog. You might call it lupus fog, for example. And could restoring your sleep help your memory? That's a possibility. But still, what came first, these problems or the sleep problem? They're all interconnected with insomnia or problems with sleeping. But you know, one thing that they have in common is stress. We do know that stress is an important trigger for lupus. It increases the risk of getting lupus. We do know that from the Women's Health Study, for example. And there's some evidence that decreasing stress might actually help out lupus, and it certainly can help out with sleep. So there are multiple studies that show that lupus can potentially be caused by the lack of sleep. There's one study that shows that a lack of sleep may possibly cause lupus to flare up. But how can this happen? There must be something going on with the immune system. And we actually have research that shows that the lack of sleep can cause immune system abnormalities. Both in humans and in rats and mice models that develop lupus, they've shown that those people and those animals who have a lack of sleep, that they have an increase in inflammatory cytokines such as interleukin-6 and tumor necrosis factor. Cytokines are the way that white blood cells talk to each other. So some cytokines, which are molecules, will tell other white blood cells to calm down and decrease inflammation, while others, cytokines, will increase inflammation. And by causing humans to have decreased sleep in research studies, there was actually an increase in inflammatory cytokines. There's other studies in humans that showed that there was an elevation of C-reactive protein. Many of you have heard of that because your lupus doctor has shown you that your C-reactive protein was high when you had a lupus flare, for example, and they saw that in people who had a lack of sleep. There is also a decrease in TREGs. TREG is a type of T cell that regulates the immune system. There's actually less TREGs in lupus patients. There was also decreased amounts of interleukin-2 and natural killer cells. Interestingly, all of these happen in lupus patients when their disease is active. Then you have to ask the question, if people who have a lack of sleep, if you then have them get a good night's sleep, does that help their lupus? And there's actually one study that shows that getting more sleep can improve the immune system. Then the study that looked at natural killer cells, the number of natural killer cells came up when they had a good night's sleep. So very interesting research. And so helping your sleep may very well help out your lupus. Now let's look at the lupus mouse models. This is a picture of a mouse who has that malar rash or that butterfly rash. There's actually animal models where every single mouse will develop lupus over time, or something that looks like the systemic lupus that we see in humans. And so there's a lot of research that they can do with those particular mice. One interesting study is they took a large number of these mice and they had some of them get a good night's sleep regularly, but some of them, they sleep deprived them. So they took 28 mice and just had the lights on all the time. They kept them from sleeping very well. And then the other mice, everything else was the same. They fed them the same food. They had them in the same type of cages, but they let them have a good night's sleep. And then they looked at what their immune system did over time. In the mice that did not get enough sleep, 21% of them at the 13-week mark were positive for anti-nuclear antibody. Remember, that's the most important antibody that we see in our lupus patients. But none of those who had a good night's sleep had a positive anti-nuclear antibody. So the mice that were sleep deprived were having an increases in their immune system and the development of their lupus at an earlier time frame. So again, another study showing that sleep deprivation can actually increase the risk of developing lupus. And not only that, but develop it at an earlier time than usual. So if we have people with lupus get increased amounts of sleep who are having insomnia, can we possibly decrease lupus disease activity? That's the big question. And we truly don't know. We don't have a study yet to prove that getting a good night's sleep helps out with lupus disease activity itself, as far as decreasing flares, for example. However, the research is pretty strong and suggests that they could potentially do that because it does seem to help out the immune system itself. Nonetheless, getting a good night's sleep has multiple other health benefits. For example, people who get a good night's sleep, they tend to have better memory, better energy levels, lower stress, and have a healthy body weight. All of those things are very common in lupus patients. Just think about it. If you could get a good night's sleep and have less lupus fog, more energy, and have a better weight, you'd be very, very happy. You know, with getting a good night's sleep, almost all the insomnia experts recommend one type of treatment to help out. This is something you need to write down. If you have insomnia, this is what you need to work for. And what is it? It's something called cognitive behavioral therapy for insomnia. Every insomnia and sleep association that there is lists this as their #1 recommendation. You can actually do this over the internet, by the way. You can do a Google search for cognitive behavioral therapy for insomnia and do it yourself over the internet. It does cost money, so unfortunately, if you can't afford it, it's not something you're going to be able to do. But insurance might pay for it, by the way, if you have experts at a large medical center who do this as well. But this is what you need to do. It's a very complicated process. It actually helps people change the way that they think about sleep, and it helps them work on good sleep habits. But you can also work on this on your own and do something called sleep hygiene. If you Google sleep hygiene, you'll find a lot of lists of do's and don'ts on ways that you can help out with your sleep, which are shown by the icons on this slide, by the way. Or you can go to my website, lupusencyclopedia.com, click on the lupus secrets on the top, and I have a free handout at the bottom where you can click on the sleep hygiene handout, print it out yourself. Now, what I recommend that you do with this list, by the way, don't just look at it and say, oh yeah, I should be doing these things. What you want to do is commit yourself to 15 minutes, take a yellow highlighter, and then highlight every single thing that you're not doing. And then you want to work on every single lifestyle habit, incorporate it into your life, and I guarantee you that you'll get a better night's sleep than when you were not doing them. And just some examples looking at these icons is you don't want to drink caffeine, definitely not after 5 p.m., but also no alcohol because it interrupts sleep. It helps you fall asleep, but then it decreases sleep in the middle of the night. And also cigarette smoking, nicotine decreases the ability to sleep. So you want to do all of those things in the morning. You want to make sure that you have a good sleep environment. Getting into good habits like brushing your teeth right before bedtime. Make sure it's dark inside of your bedroom. Only use the bedroom for things such as sex and sleep, and not having a TV in there or working on work or looking at your computer or things such as that. Exercise is very important. Always do it in the morning or afternoon. Don't do strenuous exercise right before bed. Taking a warm bath or shower, that actually helps because the warmth of the shower or the bath raises your internal body temperature, but then as it cools down afterwards, that actually helps you get a good night's sleep. So there's lots of good recommendations on things that you can do to help your sleep with sleep hygiene techniques. Now, if you're doing all of those things, or you're working with cognitive behavioral therapy for insomnia, if you're still having trouble sleeping, then you really should ask your doctor for a sleep study. A sleep study is where they closely monitor you while you're sleeping in a hospital environment, and then they look for disorders such as obstructive sleep apnea and narcolepsy. Those are actual diseases that keep people from going into the deepest parts of sleep and cause insomnia and problems with fatigue and tiredness. And these are serious health problems, by the way. For example, sleep apnea, it's underdiagnosed in women, and lupus patients are more likely to have obstructive sleep apnea than the general population. So if you have any question at all as far as having insomnia and trouble sleeping and fatigue, ask your doctor to order a sleep study, because the treatment of sleep apnea is very important, not just to increase your energy levels, but to improve your health overall. So as we've seen, we're coming to the end of the talk. The lack of sleep has been shown in multiple studies to increase the risk of getting lupus, and that might even increase lupus flares. Even in lupus mice, the lack of sleep increases their risk of getting lupus at an earlier age than they should, and there's some very interesting research showing that the lack of sleep causes abnormalities of the immune system that we actually see in our lupus patients. But you can get help. If you have problems sleeping, look up cognitive behavioral therapy for insomnia. There's a lot of stuff you can do at home with sleep hygiene habits, and then consider asking your doctor for a sleep study. But whatever you do, I want to end this talk by making one important recommendation. Don't stop the video and then just say, yes, I should be doing those things to help my sleep. Instead, take action. Go look up and Google cognitive behavioral therapy for insomnia. See if you can afford a course. Go to my website, download the free handout for sleep hygiene, commit yourself to 15 minutes, use that highlighter, highlight the things you should be doing, and proactively work on incorporating those into your life. If you do these things, I guarantee that you'll help yourself sleep better, you'll have significantly improved energy, possibly better memory, and your quality of life will be so much better. And please consider joining Kaleidoscope Fighting Lupus. It's a fantastic organization that has lots of educational programs such as this to help lupus patients live a much better quality of life. And thank you.
Thank you, Dr. Thomas, for sharing your time and expertise. We hope you found lupus, sleep, rest, and counting spoons helpful, and that you share this video with others. Once again, a special thanks to our program sponsor, GSK, for their generous support in making this educational presentation possible. You can find more lupus resources on GSK's Us in Lupus website by following this link or using its QR code. We also thank our community sponsors, 7 Minute Cinemas, Tin Rocket, Blue Eyed Crow Studio, and Due North Studios for their incredible support. And we want to thank you for watching. We encourage you to visit our website, kaleidoscopefightinglupus.org, and follow our social media platforms for the latest lupus news, program information, award-winning blog articles, and so much more. Thanks for spending time with us. And remember, you are not alone. I'm Annika Hazlitt for Kaleidoscope Fighting Lupus. Please take care.